How are you doing, sir?
Very good, thank you. It's a
Really
nice bright morning here in Texas.
Sure, sure. Nice to see you again after a long time on a weekend morning.
Yes, it is.
Welcome, sir. Welcome back. So, guys, welcome all to our ISOMT free live lecture on Dr. Vince Baugher, who is a doctor in chiropractor from USA. He's currently practicing in Texas, and he has his own decompression center. All right, so he's a big name over there, and we would be discussing about the manual therapy and its effects on visceral improvements, and that's quite a nice topic, Dr. Baugher, that everybody in today's world have stress, blood pressure, anxiety, heart rate, unknowingly, and I'm sure the PTs and the doctors and the fraternity can help everybody in helping the patients in all these ailments and all. So without further ado, thank you so much for the quiz questions over there. Guys, we will have a quiz after this lecture. And our policy is people who actually pass the quiz, they get certificates from our organization. All right. So Dr. Baugher, without further await, I would let you start. All right. Thank you, sir.
Thank you. Welcome everybody who's here. I'm sure there will be more people joining, but there's a lot of material to cover. So I want to go ahead and get started, and we'll have a bit of time at the end of this hour also for questions. No doubt there will be things that people want more clarification on after this presentation. So if you have any questions, you can just hold on to those until the end of the presentation. So let's take it from the top. Not quite yet. I want to get a camera going here. There we go. Okay, so as PK said, we're going to be talking about how to get visceral improvements using manual therapy. Now, as I understand it, most, if not all of us on here are manual therapists. And our realm has been seen to be limited to musculoskeletal conditions, aches and pains of the shoulder, the back, the neck, knee improvements, things like that. And yet I came across a new technique just a few months ago, maybe 6 months ago, called zone therapy, which I have found to be an extremely effective way to help with many visceral issues using a manual therapy approach. So this is not how we manual therapists can begin using medications or herbs or things like that, but using generally just our hands that we can help out with things like PK said, with blood pressure, digestive issues, things like that. So we'll go into a lot of detail on that in a moment. A few examples first. So I have a 91-year-old patient who I've been treating for quite some time, and she has had steadily increasing blood pressure over the past several years. And a few months ago, she came in with her BP at 173 over 110, which I think all of us know that that's not a good place to be. And she came straight from her medical doctor's office and said that, she said, I don't like to take medication, but my medical doctor insists now that I have to, or I'm going to die. And so I said, well, let's try out this new technique that we have just come across and just gotten trained in, and just see how you respond. So after just 2 months of doing the zone 6 stimulation, which we'll go into the details of that in a few minutes, her blood pressure is now down in the 130s, usually lower 130s, completely medication-free. Another patient of mine, a 39-year-old female named Erin, she has had chronic constipation. She has had, since pretty much she was born, she has had bowel movements every 1 to 2 weeks. That's one bowel movement every week or two. And after only 4 zone 2 adjustments, she is having bowel movements every single day. 74-year-old patient of mine with shingles, severe, unremitting for 7 years, painful shingles across the side of her torso with no relief whatsoever from any medications that she's taken. We started doing the zone technique with her, and after 6 zone 3 adjustments, she's completely cured and has been symptom-free for over 2 months now with no signs whatsoever of that. The only thing that we've changed, doing zone adjustments, specifically zone 3. So how did zone therapy start? It began with the gentleman named Dr. Thurman Fleet, who was a chiropractor who began practicing in the 1920s. And excuse me, almost 100 years ago, he began to develop this new technique with lots of experimentation and discovered these 6 different zones in the body. And so we'll get into those individual zones in a moment. So let's talk about the philosophy, the paradigm that Dr. Fleet approached this with. That is that there can become stress or imbalance or interference in the parts of the brain that control the different systems in the body. So 6 different centers of the brain, each one controlling a different system in the body, circulatory, digestive, like that. And those centers can begin to develop interference, static imbalance in them from stresses. And he said that stresses can be of 3 different categories. The first is physical. You can be in a car accident and get whiplash. You can bend over and pick up something wrong and hurt your back, causing interference, causing a stimulation, a negative stimulation of the spinal cord, which causes a glitch up here in the control center. Or you can sleep wrong or things like that. So physical stresses, maybe working at a computer all day. We can also have chemical stresses. So that can be from eating poor food to chemical toxins, maybe pollution or things like that we were exposed to. And even though that's a chemical stressor on our body, it begins to affect the brain. And for whatever reason, different types of stresses will hit different centers in the brain more primarily. And we can also have mental or emotional stresses. So things like the pandemic, financial stress, family, emotional stresses, things like that, can also begin to cause glitches in our brain. So if we think about a simpler example than the human brain being the most complex 7 pounds in the known universe. So to break it down a little more simple, let's take your cell phone. So if your cell phone is like mine, it can, for whatever its reasons are, physical stresses, chemical stresses, emotional stresses. I don't know why phones get glitched up, but mine does pretty frequently. And sometimes a computer as well. So what's the best thing to do, right? The first line of defense, if the good old iPhone starts to give you trouble, the best thing to do is let's just reboot it, right? You shut it off and leave it off for a minute, then you boot it back up. And the vast majority of the time, whatever that glitch was, it's gone. And the brain, according to Dr. Fleet, is the same way, that we can reboot the brain and then the systems in the body begin to function better. So let's get into some of the technical side of how is this zone therapy treatment done. So let's look first at the diagnosis side and then at the treatment side. So diagnosis is very simple. Basically, you palpate along the base of along the superior nuchal line of the head. So right along here. So basically at the top of the ear. So if hopefully we all know where the mastoid process is, right? This bump that's right behind the ear. So if you take your finger, you place it at your ear, you go back, you go over this hump, which is right here. And then you get into a little groove. So if you go up from there to the superior nuchal line, where is that? So the base of the skull has a little bump called the EOP, or external occipital protuberance. Little bump right here, that guy right there. So straight across from there, this is the superior nuchal line. Down here is the inferior nuchal line. It's kind of the very base of your occiput. So that's not what we're looking at. If you need to, you can use that spot, but it's supposed to be this groove right here, superior nuchal line. So you come from the mastoid, you go over into the groove, you go up to that line, and then you go over just out of that groove, just half an inch. Actually, you guys do use centimeters. Use a centimeter, so just go over like a centimeter. And so that's your starting point. That's the point for zone 1. And then you go over, so you're going to go over all the way to the EOP in 6 steps. So it's basically the width of a finger. So, and you'll get, after you've done it a number of times, you'll get where you've got a really good feel for it and you're not overshooting or undershooting, but about the width of a finger. So if you press on, you can do this on yourself pretty easily. So right up from the mastoid groove, go over just 1 finger width, and that's zone 1. Press on it. If it's tender, then your zone 1 is out of balance. Go over 1 more finger width at that same line, and that's zone 2. That's tender, that's out of balance. You can have multiple ones that are out of balance. Zone 3, 4, 5, and 6. Zone 6 is not on the EOP, but it's just to the side of it. So when your finger is on zone 6, you can feel the rise of the EOP, but you're not on the top of it. You're just to the side of it. So zone 1, all the way over to zone 6. So we're going to look at how, before we get into the individual zones and what they mean, we're going to look at how to stimulate the spine. Let's back up a little bit. So zone technique, like I said, is 2 parts. It's diagnosis, which I've just described, a very simple way to diagnose which zone or zones are out of balance. The treatment is stimulation of the spinal cord. And this technique was created by a chiropractor, but you don't have to use chiropractic to stimulate the spinal cord. So you can use massage, you can use acupuncture. I'm not going to go into those techniques because that's not what I do. I'm a chiropractor, so this is what I use. But I will show you some simple chiropractic and chiropractic-like techniques that you can use, assuming that you're a manual therapist and you've ruled out any contraindications, right? There's no fracture. You're not concerned about the possibility of a tumor, cancer, infection, things like that. In the areas that you're working on. So all of that set aside, here are some basic ways, real simple, easy to apply ways to stimulate the spinal cord in order to send this computer code up to the brain, to reboot that part of the brain.
Dr. Baugher, I'm sorry to interrupt, son. I'm sorry to interrupt.
Yes.
Many people are actually finding it difficult to hear you properly. Maybe the voice is echoing, or maybe the voice is a bit low. So is there a way we can kind of increase the volume, or maybe like it's echoing a bit? I guess many people are saying that the voice is not very audible, clear.
Oh my goodness. Okay, I apologize for not having been looking at the chat, assuming it was questions for later. Thank you, PK, for bringing that up. If I project my voice louder, is that better or is there more echo?
It's actually a little better, but it's still echoing a bit. I don't know. Echoing. Do you by any chance have any kind of earphones or anything, if you don't mind? I mean, any earphones or anything?
That's a good question. Let me try that.
Okay, now I'm using my AirPods. Is everything, my voice any clearer?
It's much better, sir. Thank you so much. Appreciate that.
Is it? Okay. Okay, thank you for letting me know.
Sure. So zones, we were discussing zones.
So PK, I want you to give me just honest advice here. I could start completely over from the beginning, or I could take over from where I'm at now. Which do you recommend? I want people to get the full value
yes, sir.
Of what they came for.
We would appreciate if you can start with the zone thing, like the people are not able to understand the zones and the what exactly it means and how the chiropractor kind of uses that. So we can start from the zones part.
Okay. So when you say from the zone spot, do you mean from the explanation of how the zones work, skipping the testimonials?
No, yeah, from the zone therapy, like what is a zone, and yeah, from there, exactly.
Okay, got it.
Thank you.
Sure. No, thank you for that input, and my apologies to all of you who have been patiently waiting and trying to understand what I've been sharing here. So PK, please interrupt at any point. I'll trust you to watch the chat.
Sure.
So the zone. Okay. So zone therapy is a paradigm in which we recognize that there are 6 different centers in the brain, and each of those centers controls 6 different, each of those controls a different system in the body. This was created by a chiropractor. I am a chiropractor, but you don't have to be a chiropractor to get excellent results with zone therapy. It's based on the sense that we can get stresses on our bodies from either physical stresses like whiplash or lifting something wrong or sleeping wrong, chemical stresses like eating bad food or getting exposed to pollution or other toxins, mental or emotional stresses, easy to recognize, and those can cause glitching in our brains, just like your cell phone can get glitched. And when your cell phone glitches, then the best thing to do is reboot it. So with this zone technique, the way to reboot a center in the brain is to first analyze to determine which one is the one that's out of balance, and then to stimulate the spinal cord at 4 specific levels. And that sends like a computer code up to that center in the brain to reboot it, to turn it off and then back on. You don't lose any function or anything like that as it's doing it. And then that part of the brain can send clear signals down to the organs of that system so that they begin to function better. Because the human brain knows how the body is supposed to work. And if the body's not working right, it pretty much always knows how to fix it. So analysis of, so 2 parts, diagnosis and treatment. As with any of us, any healthcare practitioner, find out where and what the problem is, and then figure out what the best thing is to fix it. So analysis of the zone. One is to go to the superior nuchal line. It's a ridge. It's actually a valley at the base of your skull, a little above the base of your skull. So the inferior nuchal line is right down here. It's the very bottom of your occiput. It's where the skull meets the neck. So we're not talking about the inferior nuchal line, but the superior nuchal line, which is parallel to the EOP, this bump right at the base of your skull. Thank you. Accidentally, I muted for a moment to clear my throat and couldn't unmute. So the way to determine, so this is very important. So we'll go back over this, hopefully more clearly understandable this time. So there are 6 spots along this line here, and each spot is about the width of your fingertip. So the way to find the first spot is to go up from the mastoid process is the bump, about that big, right behind your ear. So just medial to the mastoid process is a little valley. So if you go straight up from there and off towards the center of your head by 1 finger width, you're on zone 1. So each of us can do a little self-analysis right now. So you press on zone 1 with about 70% of the strength that you can produce with pressure from your finger. So pretty good pressure. You're not pushing the head forward or anything. So that's zone 1. And then go over 1 more finger width from there. And that's zone 2, 3, 4, 5, and 6 is just medial to this bump right here, medial to the EOP. So to know you're on zone 6, you can feel the rise of this bump at the edge of your finger, but you're not on top of it. Some people have a more prominent EOP than others. Any questions about where we'll come back to that so that we can move forward. And so any questions that people have on the analysis here, we'll address after I've had a chance to cover the rest of it. So I talked about how there are 2 different parts here. There is analysis and treatment. So the analysis is really that simple. Pressing on the base of the skull, finding which spot is most tender. And it's okay for there to be multiple spots that are tender, but we're looking for which one is the most tender. And then it's stimulating the spinal cord. So as I said, I'm a chiropractor, so I stimulate using chiropractic adjustments. But you don't have to use chiropractic adjustments. You can use massage, you can use acupuncture, other manual therapies, but the idea is to stimulate each segment very specifically and only those 4 segments. So you don't do extra ones just because the patient is hurting at another segment or something like that. In this paradigm, it's a computer code. So only 4 spots to send the correct code to the correct part of the brain. So I don't have anybody else here with me at 9 o'clock a.m. on a Sunday morning. So I recorded a couple of short videos when I did have assistance here.
So for stimulation of the spine, what we're looking at is for the lumbar spine and the lower thoracics down to about T10, find the spot. We'll go through locating the different vertebral segments here in just a moment, but find the spot. Get your fingers on the mammillary processes, in other words, kind of the sides of the vertebrae, and just rock back and forth, pressing in about 10 times to stimulate that segment. So you'll do that for any of the lumbar vertebrae up to about T11. Once you get into T10, T9, and all the way up to about T2, which you can do, and this is pretty safe so long as you've already ruled out, fractures or any other contraindications to manipulation. Find the segment, place your pisiforms, that bone right there, on either side of that segment. Is it okay if I adjust your hand? Yes, sir. Okay. And then have the patient take a deep breath in, relax it out, give a little tissue pull. Sometimes it'll pop just doing that. And then give a quick thrust about an inch deep, not pounding it, but with rapidity. So the speed is the important part. When you get up to T1, it's usually a little harder to do that. So you can get back into the...
Can I caution you, I just had a tattoo put on my left shoulder.
Oh, got it. Okay, thank you. And so we'll do, is this area okay?
Mm-hmm.
Yeah. We'll do pressure again back and forth here. When we get into the cervical spine, you'll have them not be an extension. So tuck your chin a little bit. That's good. It doesn't have to be hyperflexed, but just so there's not so much lordosis or curve that it's hard to isolate the specific segment. And then again, do a little pressure kind of rocking back and forth about 10 times each side. Be aware of any tenderness, any complaints the patient has, either verbal or muscles tightening up. If so, then ease off. And you can always ask the patient, is that a little too strong, if you do feel that. Otherwise, you don't need to ask that. And you can do that all the way up to C1. Thanks.
Okay, so that's a brief demonstration of ways to stimulate the spinal cord. I'll repeat just briefly. So from the sacrum up to about T11, the best way to do it, I don't know if you could see, but I was just using my thumbs on the side of each vertebra. So you're at the joint itself and you're pressing back and forth, and this is stimulating those joints and stimulating the spinal cord underneath there. From about T10 up to T2, using the base of the hand here, the pisiform, press in a little bit until there's no more soft tissue give, where you're basically, anything more is going to be moving a bone, and you give a quick little thrust. You have the patient take a deep breath in, breathe out, and then give a little thrust, again, about an inch deep. Excuse me. And then when you get to the T1 up through the cervical spine, fingers, thumb and finger on either side of the spine rock back and forth. So about 10 times for the rocking back and forth in the cervicals and in the lumbars.
So for stimulation of the...
Now to go over how to find the spot, because like with a computer code, if you accidentally type the wrong letter or number in a computer code, it's not going to work at all. So this technique, the zone therapy, is dependent on being able to get specifically the right 4 segments. And so this short video will go into how to find where you're at.
Okay, so for locating the segments of the spine, there are several landmarks, so you don't have to, if you're looking for C3, you don't have to start and count all the way up here. So for L1, that's just the sacrum, L1. S1 is the sacrum, and that's right in between the two dimples here, the PSISs of the pelvis. So you'll just get in there, and that's your S1. L5 is just right above that. It's the little divot in there. You can sometimes you can feel the spinous process, sometimes you can't. L4 is right above that, or if you get to the top of the iliac crests and come straight across, then you're at L4. And then you can just count up 3, 2, 1, T12, T11, T10. For T9 and above, I usually go to the inferior angle of the scapula. It's pretty easy to find on most everybody. So you just feel of where that bony prominence ends right there, and you come straight across. That's T6. So if you're going down to T7, T8, and T9, that's usually the easiest, quickest way to find it. You can also go from T6 up to T5 and T4. For T2, come straight across from the spine of the scapula, that ridge right there at the top of the scapula, straight across, and that's your T2. And then T1 obviously right above that, and C7, C6, C5. A lot of times if you're real familiar with the cervical spine, you kind of know where these are, but C1 obviously immediately inferior to the occiput. C2 just south of there, and then continuing on down. C4 obviously is the middle between C1 and C7, and so that's right at the apex of that lordosis, or that curve. C5 just below that, 6, and then 7. There's a vertebral prominence. The biggest bone right here is usually C7. So those are the spinous processes, and then for anything between T10 and pretty much T2, the spinous process is going to be just below, about one segment below the transverse processes, which is where our landmark is going to be. So find your spinous process, and then once you get into the lower thoracics, go up about one segment, and that's going to be your point of stimulation there. Thanks.
Okay, so I know that was kind of technical. There are a lot of details in there, but you can also look up online those palpation landmarks. Just to review briefly, to find the primary landmarks that I use, this will be a little simpler in summary. Here at the top of the iliac crest, if you come straight across from there, you get L4. If you go, so that's the only landmark I use down here. Everything else I just count up. At the bottom of the scapula here, you know, the scapula comes down kind of like that. So the bottom of the scapula, the inferior angle of the scapula, if you come across, that's T9. If you go to the spine of the scapula, in other words, the ridge of the scapula right here, right here, and come across, that's T2. And then the base of the skull, just below that is C1. So it's real simple. You've got the iliac crest for L4, the inferior aspect of the scapula, T6, the spine or ridge of the scapula, T2, and then the base of the skull. Right underneath that is C1. And then from there, you can just count. So it's really just 4 landmarks. So it's not as complex as it may have sounded.
Okay.
All right, so now getting into the zones, this is the fun part. This is the cool stuff of what can this actually do? Why is it even worth all of your time here this evening? So zone 1 is the glandular system. And that includes the pineal gland, pituitary, you've got your thyroid in here, your adrenals, you've got your reproductive organs are in here. Your immune system is primarily controlled by the glandular system, or in the glandular system by this zone 1. If you have imbalance in the glandular system, a lot of times you'll feel low energy, you'll have mood swings, your brain will be foggy, you can have hormonal issues. And so when I balance out zone 1, very often what I see, no joking about this, just using my hands, I'll see people saying, wow, my memory is better. I've got more energy. I'm sleeping peacefully. I feel more relaxed during the day. Immune system gets better. Hormones get more vibrant. Patients share with me about their libido is increased significantly. Also, my blood sugar doesn't crash like it used to now that I have been getting zone 1 adjustment. Again, just from using the hands, no chemicals whatsoever. I have nothing against herbs or even medication if it's needed sometimes. But it's really cool to be able to just with simple touch to be able to bring about healing and balance. So here is, in summary, zone 1. And this is the one time when you will, in the presentation, encounter which segments are included in that zone. So this is a good time to make a note of it. So zone 1, your glandular system. It's easy to remember because it's all one. T1, T1, L1, and S1. Not all of the zones are going to be that simple. All right, zone 2, the eliminative system. So this is your sinuses, your lungs, your kidneys, your bladder, your colon, and your skin primarily. And so I have allergies clear up. This is the zone where almost every patient I have with constipation, in fact, I can't think of a patient with constipation who still has constipation now that I'm doing zone 2 adjustment. Also bedwetting. So for kids who wet the bed, I'm not talking about 1 and 2 year olds, I mean like 7, 8, 12, 15-year-olds who still wet the bed. Once I started doing this, within 3 or 4 adjustments, no more bedwetting. So common problems, sinuses, allergies, like I said, kidney and bladder trouble, constipation, not just constipation, but also irritable bowel, diarrhea, and skin problems. Oh, ear infections. Anytime you've got an ear infection, zone 2, I've had really good results with that. So those, like I just mentioned. So zone 2, you'll want to write these down. So C2, T3, not T2, don't get thrown off there, T12 and L2. Now I list them top to bottom. Usually I'm going bottom to top when I am adjusting, but you don't have to. You can do it whatever order that you want, just so long as you get those 4 and only those 4 and none others. All right, zone 3. So this is your nervous system. So everything dealing with the nervous system, but also including things controlled by the nervous system. So digestive issues, reproductive organs, immune system, those can be impacted by clearing out zone 3 as well. So you can have organs that are influenced by this zone, but also by this zone and by this zone. So each organ is not limited to just a single zone, though they do tend to have their primary ones. So if zone 3 is out, hearing and visual problems, trouble sleeping, trouble focusing, trouble being calm, anything related to numbness, tingling, going down the arms and legs, hands and feet, cold hands and feet, either this or the circulatory system, you'll see that. A person who's just really anxious, worried, fearful. I had a patient who said that after her first zone 3 adjustment, she has felt more calm than she has felt after years of counseling and psychotherapy. So, improved mood, sleep. Honestly, eye and ear, vision and hearing, I haven't seen a lot of changes in those with zone 3, but all the rest of this I have. Granted, I've only been doing this for about 6 months. Definitely increased energy, definitely more calm and relaxed. So C3 is mostly multiples of 3, but don't get thrown off. So it's C3, T4, T9, and L3. So everything of multiple of 3 except that T4 right in here. All right, zone 4, your digestive system. So liver, taste. A lot of people with COVID have lost smell and taste. With zone 4, we're beginning to get a lot of those back. And this one primarily shows up with appetite problems that can be either poor appetite, excuse me, or just ravenous appetite, uncontrollable. This one also does tend to balance out blood sugar issues and food sensitivity. So I've had, I think, 2 patients so far who have been very sensitive to certain types of foods, where eating those foods will make them swell up and have other reactions. But doing a series of zone 4 adjustments, they don't have that anymore. So food sensitivities, probably food allergies. I honestly haven't encountered a food allergy yet that I've gotten to treat with this. So I have patients losing weight by balancing out zone 4. Like I said, getting their smell and taste back, and easier digestion of food, which of course can help boost your energy. You're not getting that downslope after eating. So zone 4, this one is, I like this because it's multiples of 4. I like when things kind of make sense. T4, T4, T8, and L4. So I'll let you guys jot those down. T4, T4, T8, and L4. All right, zone 5. So this one is your musculoskeletal system, sometimes just referred to as the muscular system. So pretty much we understand about muscle system. I'm going to get into strength and especially equilibrium. This is one that wouldn't necessarily stand out. So we'll talk about that in a moment. So what happens when this one's out of balance? Fibromyalgia, if you guys encounter much of that over there. Poor balance, we're going to come back to that one. Joint pain and swelling, muscles cramping, or if a patient comes in and they say, you know what, I'm just feeling weak. I just don't feel like I have my strength anymore. Disc issues, which I treat a lot of, muscle atrophy, this can help to begin to turn that around while treating the underlying cause of that. So restored proper motion, muscle strength, suppleness. Okay, restored center of gravity and eliminated dizziness. So I've had several patients have issues with that. One of them comes to mind from just yesterday, who unexplained, none of the doctors that he's seen over the past several months have been able to address or find out why he's got just this real sense of imbalance. It's both up here and it's down in his lower extremities that he feels like he just can't, just not balanced, and very concerned. Strong, healthy guy in his 60s. And so I said, hey, let's do some zone 5. And with doing zone 5, that is steadily getting better and better, even though all the other doctors and medications haven't been able to touch it. The zone 5, almost totally logical, almost all 5s and multiples of 5, but this one's off a little bit. So I've got C5, T5, T11. Don't get lost and do T10. T11, and L5. That's why it's good to have a little chart, a little cheat sheet next to your in your treatment room, so that you make sure that you're stimulating the right one. Because as I said, if you send, it's like a combination lock. If you put in 3 numbers right but 1 wrong, the whole thing is not going to unlock. You don't even get closer with that. So it's real important to get the right segments of the spinal cord to stimulate. And then finally, zone 6, the circulatory system. So this one includes the thyroid, which you may remember we had in zone 1 as well, thyroid. Blood pressure, I shared in the beginning, if any of you guys were able to hear me at that point, about the 91-year-old with chronic high blood pressure, whose blood pressure is now down from the 170s down into the lower 130s, nice and steady. Improves with circulation, including cold hands and feet, which we also saw in zone 3, and lymph and blood vessels. So high blood pressure, poor circulation, like I said, cold hands and feet, thyroid issues, headaches typically zone 3 and zone 6, so zone 3 nervous system and zone 6 circulatory system. Bruising easily if that's not caused by medication. And so balancing this zone means that you will get normalized heart rate, blood pressure, just good circulation. And so zone 6, there's not a lot of just intuitive on these numbers. So you just want to have these written down until you begin to understand them better, to remember them better. C6, T2, T10, and L1. So C6, T2, T10, and L1. You could say, oh, 6 and then 2 and 10, that's a 12, that's a multiple of 6 and L1. I don't know, whatever you need to begin to remember this one. So those are the 6 different zones. So after doing your checking of the skull, determining which zone is the most tender, stimulating those spots on the spinal cord, go back to that zone that was most tender, or if there were multiple ones, then go ahead and press on whichever ones were most tender. But especially the primary one that you just treated, and see how that tenderness is. And almost always it will be less or completely gone. If it's not completely gone, and sometimes it won't even be less right away. If it's not completely gone, don't worry about it. As with many things, it can take multiple times to clear a zone. If it's not any better, feel free to go back and do a little more stimulation on each of those 4 spots. Only one more time. And if it's still not any less tender, it's okay. It may be that you're just building up the confidence in it. It may be just that the patient's, that zone control center in the brain is just really staticky, and that it will need multiple approaches. But your confidence as a practitioner plays a big role in the results that you'll see with patients. But how can you be confident if you're just trying something for the first time? So the more you practice this, the more confident you will become, especially as you begin to see the results that I have been seeing that have just blown me away with how effective this technique can be. So I want to leave some time. We've got about 10 more minutes for there to be questions, and I'll let TK moderate those questions and just feed them to me.
Sure, sir, sure. So guys, if you have any sorts of questions and concerns for zone 1 and zone 2, person wanted to know about the zone 3 spinal segments.
Okay, so let's see, I could type these. Why don't we go to the next question, and I'll go ahead and retype these.
A person wants to know like the mechanism behind the zones.
Uh-huh. That's an excellent question. It's all neurological, and we do not fully understand it. We definitely don't fully understand how the brain works. The most complex 7 pounds in the known universe, and so it's basically, as we understand it. And I'll type these out again in just a moment. But as we understand it, it's that the brain, the 6 different centers in the brain that control between them every single cell and tissue in your body, that they can get static in them, and that somehow our divine creator has created this hack where stimulating 4 specific segments sends a reboot to that part of the brain to clear it out, so that it then begins to be able to control properly the organs in that system.
Sure. And another participant wants to know, Dr. Baugher, that whether this zone therapy can help in neural tension pain.
Neural tension, is that neural like tension headaches?
No, like the nerve pain and like the having a radiculopathy or any kind of a nerve pain.
Oh, yes, absolutely. It may not be the only thing that's needed to cure it. There may be other things depending on what the underlying cause of it is. But yes.
All right. Another participant wants to know whether they can be used on a genetic disorders, the zone therapy. I don't know what she's trying to imply. Yeah.
Well, I don't, according to my understanding, it doesn't do things to transform the genes, but it can, if your genetic disorder, if your patient's genetic disorder has symptoms from it that fall into any of these zones, then those symptoms can be significantly mitigated, but it won't change a trisomy 3 or a Duchenne's or a it won't change the genetics there, as I understand it. At least I'm not good enough to do that yet.
Yep, yep. Many of the people, Dr. Baugher, they wanted to know, like, is there any kind of a reference book for all these zones and where they can get the knowledge from and study from?
Honestly, I don't know. I have been to very expensive seminars myself in order to get this. And if you go to zoneschoolofhealing.com, the basic training is $2,000 US. But with that, you will get a tremendous amount of training and information.
All right. And I'm sure this can be done with patients with headaches and migraines too, I guess.
Yes, absolutely, with really good results.
Yep, yep. And how frequently this is done, Dr. Baugher? Like daily, weekly? What's the dosage like?
It's kind of like with any condition. It's going to be a vague answer, but any condition that you treat, if it's an acute, intense condition, then more frequently, like daily, is best. If it's something that that is more mild and or more chronic, then you can space it out 2 or 3 times a week.
I guess this zone thing is like a new concept for like physiotherapists or PTs around the globe, and they might have a lot of questions. That's why they're asking about the reference. And they wanted to know, some of the people wanted to know, yeah, about the evidence or any research supporting this method. I'm sure there will be some.
That's an excellent question. There isn't any that I know of, actual evidence, because it seems like most people who are practicing this are really just field practitioners like us, like you and me. And so they're just out there getting people better and maybe doing case studies, but I don't know of any. It's really hard to get funding for something like this because nobody is going to make money off of it except for the practitioners. So it's not like drug companies that will make billions. Pseudo limb sensation post amputation, yes. I have not had that myself. I haven't encountered that myself, but I do know of another practitioner that has gotten really good results with that. Zone 3 is what they use.
Any kind of indications in like a reproductive or OBG gynecological conditions, Dr. Baugher? Like
there are no known contraindications there because again, we're just working on balancing out the neurological systems in the body, and so it's nothing that that would have a negative impact on those who are pregnant or nursing.
I see a lot of questions pouring over there. Yeah.
Yeah, excellent question. Exceptional cases. I'm not sure if exceptional cases refers to like really cool testimonials that are amazing, or cases where you shouldn't treat with this. Any errors anything that I just typed out that doesn't match with the slide, I was wrong because I'm trying to type and speak at the same time. So zone 6, C6, T2, T10, and L1. So if I typed L2, I was wrong.
Oh, all right.
So one excellent question, so Rekha just asked a question that is very pertinent, and that is, can you have multiple zones tender at the same time? Absolutely, probably half of my patients do. So I palpate and I say, here's what I say. I say, I'm gonna press on 6 spots on the base of your skull, and I kind of touch all the way across there. And I want you to tell me by number which one was most tender, and then I'll tell you what that means. And so I palpate those 6. I say 1, 2, 3, 4, 5, 6, like that. And then often they will say, oh, it's between 5 and 2. So I will go back in the reverse order. So I went 1 to 6. So I'll go back and I'll press on 5, and then I'll press on 2, so they can compare just those 2. Usually when I just compare just those 2 or maybe 3 that were the most tender, then they say, oh, it's definitely this one, when they can compare just those. If they say, it's a little hard to tell, it still feels about the same, then you've got 2 choices. Either you can go with symptoms, like it's between zone 2 and zone 5, but they're talking about constipation, excuse me, then just go with zone 2. Sometimes I won't even palpate. If they're like, doc, I've got bad constipation, I mean, like, okay, let's just do zone 2 then. Or my blood pressure is high. Okay, let's dive in and do zone 6. Or you can also, as a secondary way to determine which one may be primary, palpate the cervical spine. And if they said zone 2 and zone 4 were equally tender, palpate C2 and C4, see which one is more stuck, which one's more restricted or tight, and then let that one be the one. Yes, when I said zone 6 has L2, I was wrong. Zone 6 is C6, T2, T10, and L1. Stimulation is at the transverse process in order to stimulate the joints right there, which sends stimulation into the spinal cord. So yes, you're pressing on the transverse process of the thoracic spine. In the cervical spine, it's the lamina, and in the lumbar spine, it's the mammillary processes. Just basically think about stimulating, about getting motion into the joint right there. Meta says, is L1 common both to zone 1 and zone 6? Yes, it is. Somebody's really paying attention to their numbers. So T4 is also common to both zone 3 and zone 4. So don't get confused about that. And Nihar, excellent question. I'm glad you mentioned this. So, so can we stimulate multiple zones when the multiple symptoms are presented? No, don't do that. Choose one zone per visit, because the more focused and clear your computer code is up to that part of the brain, the better results you get. If you stimulate anything besides those 4 segments for that one zone, then you lose the clarity of the computer code that you're sending up there. So choose one zone per visit. Stimulates transverse process about 10 times. Go with what feels right to you, but I don't count it. But you know, if I'm doing an adjustment, it's just a single thrust. But if you're doing the pressing back and forth, maybe about 10 times. Put some good thought, energy, and love into the patient to that point. Oh, and on the base of the skull, it doesn't matter which side you palpate on, it's bilateral. So just choose one side just for simplicity and clarity. And acupuncture, you can use, I don't do electrical acupuncture, so I can't comment as to whether it's okay to do it up here as high as the occiput. That's outside of my knowledge base. You guys have excellent questions. PK, I'll turn it back over to you to be respectful of people's time. And needling, yes, feel free to use needling, whatever you use to stimulate the spine, do it.
All right, I know the questions will be endless. It's a new concept for them, I guess. And see, the question will be endless. I'm sure, guys, you want to review this recording, you want to review this literature, this presentation, this will be there on our website. You're welcome to go and access through our website. Dr. Baugher, thank you so much for your valuable time on a Sunday morning. We really appreciate that. And guys, if you want to see this lecture again, you're welcome to go and access on our website, and you're welcome to become our premium members. There's a quiz that we'll be sharing on the chat box or on our WhatsApp. So people who are welcome to attend the quiz, if they understood something or the other from here, they're welcome to retest themselves. And that is what our policy is, that you can't learn unless you relearn, retest yourself, and perform good. All right. So thank you so much, Dr. Baugher. We hope to hear more, and we hope to see you more from all these chiropractic miracles. Because, you know, in India and in Asian countries, all these fancy YouTube videos have been there, and people have been carried away, and everybody wants to be a chiropractor these days because they want to get quick results. But yeah, when we discussed last time, we said that you can't be a chiropractor in a short-term course or something like that. So it's a whole doctorate degree, it's a medical degree. So yeah, anything you want to mention and help people, say to people regarding the manual therapy and ISOMT and whatever, if you want, you can throw.
No, just it's such an honor to get to interact with so many of you and of my fellow peers across the world, or the other side of the world. So thank you for giving me this opportunity. Thank you.
Pleasure is all ours, sir, because yeah, there are people all over the world, especially from India, Asian countries. They hardly get resources from the Western or the Eastern world. So thank you so much for sharing your knowledge, and we will hope to see you soon, very soon. All right. All right, guys. Any question, concerns?
Thank you.
Mention in the chat box. Thank you, sir. Thank you. Take care. Good night. Have a good weekend.
You too.